Welcome back to Breakfast with Bridget. We are talking to Dr. Treshonda Bockham again this morning, but we want to address this time of year Suicide Prevention Awareness Month. That is the month of September. Right now is Suicide Prevention Week. And Dr. Bockham, it's good to have you back with us this morning. Good morning.
Good morning. It's good to be back again.
When we look at suicide prevention awareness, what's happening in Florida with that? Because we know that the rates vary depending on age group, ethnicity, and there's lots of different reasons why this happens. But what is it like in Florida as far as the rates go?
Yeah, looking at Florida health charts, they had some statistics available for us, and we had 13.2 million individuals who considered suicide, 1.6 million individuals who attempted suicide, and in Florida in 2022, there were almost 3,500 deaths by suicide.
And so the numbers are really high for people just even thinking about it. And of course, different reasons behind that. But what can you tell us about what causes people to consider it? Is it's situational? It could be something happening internally.
Yeah, there are several factors that can put an individual at risk for suicide. One of them being family history of suicide, drug use, because they can create extreme mental highs, but low points that can impact suicide, intoxication. Research shows that 1 in 5 individuals or who have committed suicide had alcohol in their system. Those experiencing extreme and chronic medical issues, prolonged stress, trauma, or abuse are some of the risk factors that put an individual at risk for suicide.
And I noticed that the numbers were pretty high among senior adults, as well as you said, there are some trends among the younger age groups, and the numbers are going up among some of the younger age groups. So there's different things
Yeah.
happening with those age groups.
Absolutely. So if we're looking at age groups, you can see that the second leading cause of death um, for suicide is for those individuals ages 10 to 34. It's the fourth leading cause of death for individuals ages 35 to 54, and the eighth leading cause of death for individuals 55 to 64. So we could see kind of where suicide lies, just depending on age groups as well.
And many times people talk about how when someone's lost to suicide that sometimes no one even knew. What are some things that we can do to be more aware? No one even knew maybe
Yeah.
that person was struggling is what I meant to say.
Yeah. So the warning signs may look different, whether you're looking at a youth or an adult, and there may be some similarities. But sometimes youth may actually be more willing to talk about suicide and talk about their plans for suicide, whereas adults may talk about more so being a burden to others. They both experience extreme hopelessness about the present or the future. You may see changes in their sleep, whether that's sleeping more or sleeping less. You may see some anger, some irritability, and an increase in substance or drug use as well.
hmm We talked about some of the ways that it happens, and so when we look at, you mentioned alcohol and drugs as well as firearms, and then many times people who may have contemplated or tried to attempt suicide may revisit that again. So, what are some of the resources and processes around making adjustments or just trying to help a person overcome that?
Yeah. One of the things is we want to be open and honest and ask those questions. So a question may be like, have you had thoughts of hurting yourself, and do you have a plan to do so? And that would help us to understand that could possibly
All
remove arms or weapons. We could provide the 988 suicide crisis hotline that's available 24/7, and continue to be a support and offer resources as well.
Okay, and so you mentioned 988. Where can we go for more information before we go?
Yes, NAMI is a great resource. And so you can go to NAMI.org. And there is also the suicide prevention website that has nice month-long posts that you could share on social media. It has warning signs and tips and resources as well.
And there is hope. So if someone is experiencing hopelessness, you can tell them that there is hope on the other side.
Yes, there is hope on the other side.
All right, Dr. Backham. Well, thank you so much for that information, and I hope to see you again soon.
Thank you. Me as well.
All right, so we are going to wrap it up for this breakfast edition. We'll see you at noon today, and I'll see you back here again tomorrow at 7:30. Have a great day.